Welcome, everyone. My name is Michael Walsh. I'm the chair of the Humanitarian Security Challenges Working Group. The mission of the Humanitarian Security Challenges Working Group is to provide a professional framework that can be used to collectively analyze the increasingly complex challenges that are impacting search and rescue teams and emergency medical teams in armed conflicts and other insecure environments around the world. Today, we have with us Dr. Stanley Chartoff of Team Rubicon, who has been responding in many of these environments. I'm really grateful to have you here today. I'll start with my first question. Can you please provide us just a little bit of a background on your work, who you are, and what Team Rubicon has done in armed conflicts and insecure environments?
Yes, my primary job is as an emergency physician based in Hartford, Connecticut. Faculty for the University of Connecticut Emergency Medicine Residency, as well as our International Disaster Fellowship. And also retired colonel from the U.S. Air Force with a combination of active and reserve, multiple deployments as a critical care air transport physician. With Team Rubicon, I've been with them since 2018. I'm their North Branch medical lead with multiple deployments to a variety of different areas. Both humanitarian for sudden onset disasters as well as armed conflict. The most recent armed conflict we've deployed to is Ukraine, where we've done both providing medical care for internally displaced people as well as providing training to local civilians in the country. And also, I've most recently deployed to Niger, where we provided training to their pre-hospital medical personnel in pre-hospital and medevac.
And you've deployed to Ukraine, and obviously one of the challenges with Ukraine was access. It was a concern early on. Can you talk a little bit about how access was in Ukraine and any lessons you learned from access challenges that you encountered in Ukraine?
Yes, initially access was more due to the conflict. Initially, just getting permission to enter the country, getting into areas where we could provide care. In our initial wave, we were more restricted to the western part of the country, which was more remote from the direct conflict, as though it was still exposed to conflict situations while we were there. As the situation matured, we were able to move further east as lines of mobility were opened up, and we had more security and support to push further east.
And I've heard you say elsewhere that access can change in the middle of a conflict, and that's a lesson learned that you had in Ukraine. What other lessons learned? What other innovations and other things came out of Ukraine that you think can be adopted and used in future armed conflict responses?
Well, I think some of the innovations is using technology. Some of the things we did was we recorded YouTube videos of some of our training, particularly for whole blood transfusion, that we could provide to more remote areas where we could not get into. And then also the ability of setting up video training as well. So we can do virtual training, providing similar type learning that we did in person, but doing it from a more secure area and able to reach a larger audience by providing it over the internet.
And so one of the challenges you hear in armed conflicts is that sometimes, you don't have access to go into a country and provide these services. And some organizations have said that therefore you have to do it in a third country. You're talking about the third country potentially being the internet, basically, and you're being able to do it from wherever you are, including the United States, and beaming these skills into another country. Do you see this as something that other organizations are focused on? Do you think there's a need for a new organization to do this, or is this just an extension and a new service area that the traditional international humanitarian organizations are going to start providing?
I think it's something that's already happening and is expanding. New organizations may want to do it, but a lot of organizations that already have the training programs in place are seeing that they can adapt it to this situation I've seen other organizations make a stop the bleed type training video totally in Ukrainian. So they can provide that in the internet or some other means to send it locally into the country so they can view it remotely. So it's already happening. It just needs to be expanded more in more topics and wider usage.
And then the issue of principles and maintaining principles, do you think it's a challenge to maintain impartiality, neutrality, and independence in conflict areas? And do you think it's a main limiting factor of being effective in armed conflict environments for organizations like yours?
I think it's a difficult thing, but something that we were able to do. In organizations like our own, which have a large veteran base involved, there's obviously some difficulty when you go into an area of armed conflict of using your previous experiences. But I think you need to do, and what I've seen done within the organization is that you are going in there doing your job, which is taking care of patients or providing instruction to people who will take care of patients, regardless of their political affiliation as well. And that's how you do that neutrality, how you keep that independence. I think independence is probably the item that's a little more difficult because sometimes you do need to reach out for support from organizations, and you may be more inclined to receive that from one organization than another as well. But again, it all depends on what's happening on the ground.
So some of your peer organizations have obviously taken a very clear cut on this, that you have to maintain independence, impartiality, and neutrality at all times. Other ones have said, look, if you're a domestic responding organization, it's hard to remain neutral when it's your own country that's being attacked. You've talked about the challenges with independence. Do you think that there is a spectrum of opinions on this matter right now amongst the international humanitarian and domestic humanitarian organizations around the world? And do you think that's a healthy discourse, or do you think that that's just running into a potentially intractable debate?
Oh, there's definitely a wide range of opinions out there that I've heard, but I think it's a healthy debate because it's very situational. It's a very fluid environment that you have to deal with, and each individual organization has their own history, their own background, their own situation that they have to deal with, and they may approach it differently than other organizations. So each organization really needs to decide what they are going to do and try and maintain that humanitarian outlook.
And I want to ask you just about the classification system that exists for the teams. Are you happy with the classification teams as they exist today when it comes to armed conflict? Do you think we need to have a new classification structure for teams, or are you happy with what we have already?
No, I think the teams themselves are fine, because the response and what the teams are actually providing doesn't really change. What needs to be aware of is the actual individuals that make up the teams. So being aware of your roster and who is capable of deploying into an armed conflict situation, and making sure that's aware to all the volunteers of what they're getting into so they can make their own choices and decisions. That's more important than setting up separate team structures.
And when it comes to the surge rosters for armed conflict, do you feel like we have the proper surge rosters right now for armed conflicts? Do we know who the teams are that would deploy to these environments? Do you think we need more teams who are capable and willing to do this? And where do we go from here? What would be your recommendations?
Well, I think the teams that are capable of doing it are the ones that are already doing it now. There's teams that are already there all the time. Teams like Doctors Without Borders, who are always in those areas of conflict and are used to it, where others may go in separate and but to have the experience and the background to do so. So I think we're at a good point now where, especially after a year of conflict and seeing which organizations have responded and which haven't, and who has the capability, where we have that basis that we can grow on. As new organizations decide they want to go into that field, they just need to be aware of what they're doing and making sure that they have the proper structure and background to do that.
A lot about access. You've talked about how access can change in the middle of a conflict and how that's a serious issue. Obviously, when Syria, we saw how access was a limiting factor in being able to do things. Do you think there's any mechanisms that could be put in place that would help to provide that access, or do you think that that's a political thing that the international humanitarian organizations really can't contribute to a solution on?
I think it's primarily a political issue, that the governments have to work that out. I think the organizations can provide input and suggestions and information that can help them make those decisions and make it easier. But it comes down to it, it's a political decision from the governments involved.
And you talked about mental health. So, I mean, how does that impact humanitarian workers in active conflicts to know that so much of it is a political decision that's beyond their control? Is there frustration? Is that contributing to mental health challenges, or do most people who go into these environments understand that politics is going to be a big factor, either limiting or enabling their response?
I think, again, it's a little of both, depending on the individual's experience. I saw several people that went in there that had higher expectations, and when the political options caused issues and delayed our response, they needed help to understand that. Again, this is helped by briefing them beforehand, by putting out information now that we've been involved more in these types of settings, to provide that information for new recruits as they come in, and just basically have open channels of conversation so that they understand what they're getting into, and so it won't be a sudden change. It also helps to have a mixture of experienced individuals on the team that can provide that information in real time.
So how do you get people experience? I mean, not many people, even in the humanitarian worker field, have worked in armed conflict areas. And so when you're looking at the needs globally for people to be able to deploy to these places, how do you get people who don't have that experience to get that experience safely and in a way that is constructive to the organization and their own personal development?
Sure. Again, obviously, if they're veterans, if they've had their own experience, that's easy to do. It helps to have those people who have experience help talk to and train the people that do not. And then a large part of it is preparation and training and even simulation as well. That's one thing we're doing at Team Rubicon, is we provide a training course, both for it's required for leadership and suggested for medical personnel, where they go out in the field and we simulate different environments, both set and unset disasters, humanitarian issues, crises and emergencies, as well as involving security and armed conflict as well. So they can do that training in a safe environment, and helps when they apply to when they actually deploy.
So we've seen the reemergence of major power competition. It's something that's discussed quite widely. As one of the people who does the international humanitarian response on the civilian side, what's your outlook for the future? Do you think that it's going to become more challenging for you to do your work in armed conflict areas around the world? Or do you think we're getting to a point where there's a recognition that there's a need to figure out mechanisms to allow this stuff to happen on the humanitarian side?
No, I definitely think it needs to be recognized. That's an area we're going to branch into as well. I was used to it when I was in the military, being in those situations and seeing the civilian organizations come in from the other side. So with the expansion, the larger number of events going on, the larger number of disasters, it's not something that the military can handle on their own. So there has to be a cooperation between NGOs and other civilian organizations to really support these types of events.
And Ukraine was an interesting case because, I mean, that was a interstate conflict that was happening where we sent people in and they were trying to support on the humanitarian side. When you look at complex cases out there, potential cases, what would be the scenarios that would be the most challenging for an international humanitarian organization to respond into in the armed conflict, insecure environment space? And are there real world examples that would keep you up at night that you'd be concerned about if something happened, that it would be difficult for organizations like yours to be able to respond to?
I think in some ways, Ukraine was easier because it was an old-fashioned type of warfare where there was a line of conflict and two armies coming from separate sides, as opposed to a setting like Afghanistan or Iraq, where it was more terrorist organizations and there was not any clear lines of conflict or clear lines to identify who was on what side as well, which our military had to deal with, but trying to throw humanitarian organizations in there as well, being able to identify the sides and where the conflict is going when it's all over the place and it involves terrorism, it doesn't follow the rules of war. That's going to be increasingly difficult to go into.
So, I mean, given your response about the independence, impartiality, and neutrality, and then that response, it sounds like you think that the security issues, the threats to the humanitarian workers is probably a bigger limiter than the concerns about being able to actually execute your mission and remain independent and impartial and neutral. Is that a fair assessment?
Yes, I agree. I mean, if we can be in a secure area and be secure to do the work we want to do, I think we can continue to do our work.
Okay. Well, I just want to end on a couple questions about sort of, where we go from here. We've obviously published the Red Book, and there's been a lot of thought that's gone into this. Do you think that we've thought enough about this issue at this point, and that we have a good sort of set of guidelines for how to respond in these environments? Or do you think more work is needed?
I think we do. I think what should happen is all the information and data that we've obtained from Ukraine will be very useful as well. Once we have, and it's in process of consolidating all the information, and we've been there for a year now, and using that real world information to apply to what we've already set up in the Red Book and other areas as well. So it's a work in progress, but we have that base of information from a real conflict that I think we can build on that.
And one of the things in the Red Book, they talk a lot about limitations. And one of the things they said was it's not possible to provide one prescriptive way of doing things. And you've talked about how it was different in Ukraine, how it's different in Niger. Do you think these case studies are useful exercises to do after action reports for the entire response and write up these case studies and look at them? Or do you think things are so context specific that really you have to take the lessons learned at a functional level, not at a case level?
No, I think the cases can be useful because they can be applied to a variety of different situations, and not just Ukraine. You can take information from a variety of different situations, from Yemen, from what's going on in Syria. But case studies always provide at least that real world background, and it's easier to see how people react and what they actually did in a situation, and then go from there and then expand it into the more theoretical applications.
And another issue that came out with limitations, they talked a lot about the concerns about an increasing disrespect of international humanitarian law in armed conflict areas around the world. Do you think that's a new phenomena? Do you think it's an increasing phenomena? Have you seen that happen when your deployments? And if so, how does that affect the actual emergency medical team on the ground with providing care to the patients?
I don't think it's especially new. I mean, it's at least as long as I was in the military, it was not new. So, and I'm sure it's been going on for a long time. That people just don't follow the rules. It makes it different in that we have to anticipate that, particularly when it comes to security and risk taking, when we go into an area. But I don't think overall it's going to change anything than what we've already experienced.
So another limitation that's talked about a lot is the external or the foreign versus the us and other, right? Sort of construct, right? And so when you're in Niger or other places in Africa, and you're going in as a Caucasian American male into those environments versus going into Ukraine, was it different? Was that construct of the us and them sort of construct, was it different, and did it affect the way you did work? And do you think that there's enough diversity right now in emergency medical teams to be as effective as they can be?
There was definitely that situation. It's not something that's not the first time I've been in that situation, because I did the same thing with the military when we went into Uganda, and we did some training in Uganda as well. It all depends on your approach to it, understanding each other's culture and being open to understanding that. I didn't see a large issue, because they were grateful that we were there. We were grateful, and they were so appreciative of us being there that by the end of the 2 weeks we were there, it really wasn't a big issue. It was probably more of an issue of language than anything else. I don't speak French. But once we got, even with that, we were able to get past quite a bit. And it's just being, again, it's a lot dependent on the individuals that go into that situation. That's a function of training and preparation and cultural awareness that we provide before you go into an area. But I didn't see that as an ongoing problem.
And another of the limitations they talked about in the Red Book was the politicization of the response by actors in the country, and how they can actually use it to their benefit, right, in the actual conflict that's underway. Can you talk about how, as an emergency medical team, you try to make sure that doesn't happen? And does that ever prevent you from actually being able to deploy and support an operation?
I mean, we try and make it not happen by just doing our jobs, whether it's patient care, just, focusing on the patient and not the conflict itself and the political effects of the conflict. The same with the training. Even when we were training people on war-type topics like chem warfare and blast injury, we were doing it as an educational medical approach, and being neutral in terms of presenting that to the individuals we were training, who were all civilian as well, and doing that from that basis. It's educational, it's patient care. We're not trying to change or affect the conflicts of the politics itself. And again, I keep going back to it. A lot of it is just preparation ahead of time, and just that cultural awareness, and making sure everybody on the team is on that same page as well.
So the final limitation I wanted to ask you about is, they've talked about one of the challenges is differing standards between countries. In an armed conflict environment, a lot of the structures are already broken down. So is it actually easier when it comes to standards of practice and all of these other practical challenges? Is it easier in an armed conflict to be able to do your job, or is it just as difficult as any other response?
No, it's just as difficult, if not harder, because you're losing the infrastructure, but you're also sometimes losing some of the other support structure that wasn't so in other situations. and then you have the security issue on top of it. So overall, it's the same as any other emergency disaster that you're responding to, but you have that additional layer of, the security issue, the political issue, the access issue that you may not have in other conflicts.
So I'll end with this, and then we'll open it up to some questions. But if somebody came up to you, a resident in training who wanted to become a part of an EMT someday, and they said, what is the main lessons you've learned from deploying to armed conflict in insecure environments, what would you tell that student?
I would tell, the main lesson I've learned is that you're there to help people. You're doing the same job that you do anywhere else as a physician. You're going to provide medical care to, help individuals, and it's just a different context that you have to be aware of. But the actual job is the same. It doesn't matter if you're doing it in a war area, if you're doing it in an area destroyed by a hurricane, or if you're doing it in your own emergency department. You're still just taking care of patients, and you need to focus on that and learn how to adapt to everything else.
And if the head of the medical schools came to you and they said to you, what was your lesson learned from this? And they're thinking about admissions, they're thinking about preparing future doctors who would be able to go to these environments and do these things. Do you think that the medical education system we have in the US and the way it's structured right now around humanitarian health and around emergency medicine, do you think we have enough students coming in who would be willing and able to do this sort of work right now for the need that's going to exist in the future? And if not, how do you think we can improve that in the medical school field?
I think we do, at least from my view, in a program for emergency medicine, because the people that go into emergency medicine already have that bit of an ideal when they go in there. They want to do difficult things and take care of difficult situations like that. And just spreading the word out to medical schools of what we do. And I think it's an attractive thing, because that's what people go into medical school to, is to help others. And this is a great way of doing it, where you can be productive and provide that as well. And I've shown that, because I think 5 or 6 of my prior residents have already joined up for Team Rubicon. So I think I'm doing my job.
So I want to thank you, Dr. Chartoff, for taking your time to speak with us today. It's been a wide-ranging conversation, and it addressed a lot of the issues that we see facing the international humanitarian community, and having an American perspective on it and seeing the challenges and the opportunities that you see exist is really useful for that conversation. So I just want to thank you for taking the time to speak with us, and I wish you the best.
Thank you.